So you remember when we wanted this whole COVID thing over by Easter of last year? Yeah, that didn't happen. What about by Easter this year? Not going to do that either. But by this Easter, or at least the day after anyway, if you are an Idahoan over the age of 16, you could get your vaccine shot. It's the major announcement thousands of Idahoans have been waiting for, well, I guess a year. The chance for everyone to build a barrier against the airborne coronavirus. This is a big skip ahead in the vaccine distribution timeline that originally had 16 and over waiting until May. And that's great news. But how did this happen so soon? Did we suddenly have an abundance of vaccines available because of an increase in supply, or because people are just not getting the shot, at least not as many as we thought would be getting it? Joe Paris spoke with Idaho vaccine experts about today's announcement and how we got to this point so quickly.
Starting Monday, April 5th, all Idahoans, regardless of their age, medical condition, or occupation, will be able to make an appointment to receive the COVID-19 vaccine.
A major announcement from Idaho Governor Brad Little. Soon, everyone 16 and over will be eligible to get the vaccine. April 5th, however, is weeks ahead of the original goal for general population eligibility. So why the big move? State health leaders say it's in response to requests from vaccine providers.
We've heard from a lot of providers that some of them are having unfilled appointments, and they're having some issues with having more vaccine available than they are people coming in. So we wanted to be able to allow them that flexibility to move through the population groups a little bit faster.
Division of Public Health Administrator Elke Shaw-Tolik says there are a number of factors that led providers to that point. That includes vaccine hesitancy, demand from people outside of the current eligibility groups, and an increasing amount of vaccine supply coming into the state. With major vaccine availability coming soon, there are already questions about if Idaho providers will be able to keep up with demand and if there will be a long wait list.
We do have supply coming in that we anticipate can meet that need based upon the uptake that we're seeing. So there may be some pockets of the state where we do still have a little bit of wait time for some folks to get in, but we have close to 470 providers enrolled providers across the state that can help you really get the vaccine out to as many people as possible.
That very first week in December, we had just 15,000 doses total coming into the state. And this week, we are expecting both first and second doses to be over 90,000 doses coming into the state. So it's been great to see that increase.
Health and Welfare Director Dave Jepson says things are looking up, but there is a long way to go before Idaho reaches significant vaccination rates.
We're not out of the woods yet. We have about 27%, 28% of Idaho that's had at least one shot. And that's nowhere close to the number we need in the long term to really have the coronavirus under control. And we have variants that have been introduced into the state and have started to track as well.
Jepson adds, though, that the supply of the vaccine is strong and shows great promise. A new tool on the state's COVID dashboard estimates when vaccine milestones will be met based on expected supply.
The tool estimates that we will have enough vaccine supply for 50% of Idahoans 16 and older to be fully vaccinated by May 12th, and enough supply for 70% of Idahoans 16 and older to be fully vaccinated by June 16th.
So who should get the vaccine? Idahoans have asked if they need the vaccine, even if they've had COVID and received natural immunity. Experts say there is limited data and it's unclear if that natural immunity is long-lasting. So long story short, Idaho health officials say anyone who is willing and able to get the vaccine should.
We are encouraging everybody who wants a vaccine to get the vaccine. We do feel it's an important tool that we all can have in our toolbox to keep ourselves healthy.
All right, Joe, kind of a double-edged sword. I mean, opening it up to everybody to kind of make it more available. But man, that 30%, I mean, the reason we're opening it up because there's a lot of those slots that have gone unfilled. So are we still signing up the same way? That's the question. I mean, do we still go about it the same way that we've been doing it?
You can take your chances, Brian, by trying to schedule your own appointment with your personal health care provider, the person you go through to see your regular doctor. But the state really was pushing their registration tool throughout the afternoon and during the media availability they had today. Brian, as we've explained, they will put you on a list, and then providers, they will call you as soon as they have a space available. That way they are notifying people as spaces open up and there aren't long waiting lists.
And as Dave Jepson said, that jump from 15,000 a week to 90,000 doses available this week, that's pretty impressive as well. So hopefully we can use them up here in the state of Idaho. Thank you, Joe.